Hi, my name's Jenny. I'm going to be your nurse today.
Hi.
Can I get your name and date of birth?
Yes, Shaylee Patterson, 8/15/97.
Perfect. Okay, Shayla, can you tell me what's going on?
Yeah, I've just been really thirsty all the time, and I feel like it goes right through me. I have to use the bathroom all the time, and I'm tired and irritable. And in a few weeks, I hurt my foot, and it's still not healed. Is that normal?
Do you mind if I look at it really quick? Is it there on your ankle?
Yeah.
Oh, okay. And it's been a few weeks, you said?
Mm-hmm.
Hey, I'm sorry. That's really frustrating. But I'm going to try and help you out today, so can I ask you a few questions?
Yeah.
Okay. You mentioned you feel thirsty all the time. Do you also have increased hunger?
Yeah, actually, I think so.
Okay. And about, you said your sore has been there for a few weeks, hasn't healed.
Yeah.
Okay, and then you said you urinate frequently. Have you noticed anything unusual about the color or the odor?
Now that you mention it, yeah.
Yeah? Does it have like a foul smell or like sweet?
It's kind of sweet, actually.
Sweet?
It's really gross.
Okay, no, don't worry. That's totally fine. And then have you noticed any change in your vision at all?
Sometimes it does get blurry all of a sudden, but I mean, it's fine now.
Just occasionally then?
Mm-hmm.
Okay. Okay, so it could be a few things, so we're just going to run some tests first, but we're going to go ahead and call Dr. Jody to see what she wants to do before we run any tests.
Okay.
But before we do that, I'm going to have you sign this informed consent, if that's okay.
Yeah.
Thank you.
Sorry. No, you're fine.
Awesome. Okay. So we're just going to call Dr. Jody now, and feel free to ask any questions at all if you have any. Okay. Hi, Dr. Jody.
Hey guys, how are you?
Good. Can you hear us okay?
I can hear you great. Yeah.
Awesome. Okay, so this is Shaylee.
Are you able to hear me?
Yeah. Can you hear her? Yeah. Okay. So this is Shaylee. Hi. So I sent over some of her information to you and her past medical history and things like that. But she came in today complaining of increased thirst, hunger, and urination. But before I say all this, are you okay with us talking about things?
Oh, yeah.
And with the people in the room?
Yes.
Okay. So she came in with increased thirst, hunger, and urination, and she says she feels tired a lot of the time and has a sore that hasn't healed in a few weeks. We got her vital signs. Her heart rate's 73, respiratory rate is 16, blood pressure is a little high, 136 over 84, and oxygen's 98, temp is 37.1. And have you been able to look at the medical and family history?
Yeah, I was actually able to look over everything, so thanks for getting that over to me.
Yeah.
And I got a pretty good idea of what's going on. So.
Okay.
And then let's see. So today we're going to be talking about some of your personal health information, and I'm going to be asking you questions. Is it okay if I ask you those and over the camera and with everybody that's in the room?
Yeah.
Okay, excellent. Do you have any heart problems or a history of heart disease?
No, not that I know of.
Okay, excellent. All right, it seems as if you have a history of type 2 diabetes in your family. You wrote that your mom and maternal grandfather have it, and I see that you were diagnosed as a pre-diabetic a few years ago. Is that correct?
Yeah. Has it gotten worse?
Well, some of the things that we're seeing could mean that it may be worsening. So we need to run some more tests and see what's actually going on in your body. And then Jenny, I'm going to put in some orders for a fasting glucose, a random glucose test, an A1C, and let's get a UA on her as well.
Okay.
We'll go ahead and do that, the glucose test now. We'll do the finger stick, and then we'll see what we need to do about the fasting glucose in the morning. Okay. And it also looks like we need to get, we already have an A1C level from 2 months ago, and that was 6.6%. So let's get an average A1C for the past 2 months and see where we're at with that. And then after we have all these results, give me a call back and then we can talk about it some more. Okay? Do you have any questions about those orders, or do where we're gonna go from here? Either one of you guys?
No, I'll go ahead and do all that. Thank you so much, Dr. Jody.
Excellent. You're welcome. We'll see you in a bit.
Okay, we'll see ya. Okay, so like she said, we're gonna run some tests, kind of measure your blood sugars, get an A1C, and then we'll do a fasting glucose maybe tomorrow. If that's okay, and then we'll do your analysis as well.
Okay.
So I'm going to do all the labs, and then I'll come back once those results are done.
Okay, thank you.
Okay, so it looks like your results came back from your test, so we're going to call the doctor and discuss them.
Okay.
And again, feel free to ask any questions if you have any, okay?
Sounds good.
Hi, Dr. Jody.
Hey, Jenny. Hey,
Um,
Shaylee.
Did you get the results? Can you see those on your end of the test?
Yes. So I have your results here in front of me. Are you feeling better this morning?
A little bit.
And the same? Okay. It looks like your random blood sugar test was 212, which is much higher than normal. Your fasting blood sugar was 137, which is also higher than we like it. And your A1C level from 2 months ago was 6.1%, which is also higher than usual. Look at another A1C in a month or so to look at that again. But by the looks of it, your blood sugars are in the range of someone who has diabetes, type 2 diabetes. Your urinalysis came back with ketones in it, which is another indicator that you've got some diabetic conditions happening. So I know this is a lot to take in all at once, but don't worry. We're both here to help you manage this and improve your quality of life. Do you have any questions before we give you some education? Jenny's going to go ahead and do that for me.
No, it's just a lot to take in. I knew I was at risk for diabetes, but I didn't actually think it would happen to me.
Right. I know it seems very difficult right now, just getting this information. We'll take it one step at a time, okay? We're both here for you, and we're going to help you every step. So I'm going to prescribe you, we're going to start you out with 500 milligrams of metformin every day. And you're going to want to take that with dinner, okay?
Okay.
And this is just going to help control your blood sugar levels. And then we'll see how you do on that, how well you tolerate it, and depending on what happens, we may adjust the dose in a few weeks, but we'll start out at that 500 milligrams. And so Jenny's going to take some time right now to teach you some other things that you need to know about your diet and lifestyle.
Okay.
So let me know if you need anything, okay? And then Jenny, also let me know if you need anything as well.
Okay, thank you.
All right,
Appreciate
take care,
it.
you guys.
Okay, bye. Okay, so I know that's kind of a lot of information to be taken at once. And I know that it can feel pretty overwhelming, so I'm just going to go over some things with you. So we need to take your blood sugars every day, pretty much before you take dinner, or before you eat dinner, and then also take your metformin, which you talked about, every day before dinner to just keep your blood sugars down. It's important to eat a healthy diet, so foods that are low in fat and sugar. So we want to avoid any sodas or anything like that. But do you have any questions?
Does this mean I can't go to McDonald's and drink Diet Coke anymore?
Do you like Diet
It's
Coke?
my favorite.
I know we can't control what you do. You have your own agency, but we do recommend that you avoid fatty foods and sugary drinks because those sugary drinks spike your blood sugar. And can cause some problems in what you've been experiencing. So maybe just try to eat healthy snacks and sugar-free sodas and drinks like that. Okay, so can you repeat to me the things that you need to do when you go home?
I'm going to need to exercise, eat healthier, make sure I take my medication with food, and take my blood sugar.
Yeah, very good. So I know it's a lot, but
yeah,
if you can manage it, then your life will be a lot better. Okay, so do you have any more questions for me?
No, I think that's it.
Okay.